Hey there, Dr. Michael Lepore with Sarasota Vascular Specialists here again today to talk to you a little bit about limb salvage. Really why a vascular surgeon becomes so critical in the whole pathway of limb salvage in general. You've seen me or heard me speak before about non-healing wounds and how circulation can affect non-healing wounds when wounds are just not healing. That becomes critical to the recognition of a problem. And so the way this will present itself a lot of times can be either something a little bit more slow and insidious, meaning it starts as a wound that's just taking a long time to heal, and for whatever reason you can't figure it out, or the wound transforms itself into maybe a dark wound that becomes an eschar or a non-healing wound, or worse, possibly a progression into gangrene, which becomes a little bit more of an emergency or an urgent kind of an issue. Rest pain is something that's a little bit more acute with usually much more urgency to it, meaning an artery maybe immediately gets blocked off either by possibly a blockage that breaks off and blocks an artery someplace, possibly a clot that breaks off from someplace in the body, comes from the heart and a regular heartbeat like atrial fibrillation or some type of arrhythmia on a patient who possibly is off their blood thinner that should be on it, or sometimes it's the first time it's presenting itself and that's how they actually present. They all of a sudden don't have good feeling in their arm, they don't have good feeling in their leg, and the rest pain basically starts typically with a numbness in the leg, and then that will very rapidly progress to where the leg or the arm or whatever extremity is involved will become very painful to a patient to the point that they're getting to the emergency room as quickly as they possibly can. Imaging at that time becomes an important part. Now, if we see the patient in the office, we have the time. If it's not something that's an urgent emergency room presentation, we can try to figure out what the problem is and try to address it in maybe a less invasive way, such as an endovascular balloon angioplasty stenting type of way. Or if it's in the emergency setting, a lot of times we will need to go immediately to the operating room, maybe do a CAT scan first, or go straight to the angiogram suite to try to do something to open the arteries up once we figure out where we think the blockage is. The ultrasound will give us a screening way to figure out where an artery potentially is blocked up if it's more of an acute issue. This is the way to avoid an amputation. Whether it's something that's a slower presentation of an issue, as I talked about, a lot of times we see patients in the office with non-healing wounds, possibly early gangrenous changes, signals in their feet or can tell they have some circulation, but they're just not getting enough. And so we can image those patients, figure out the problem, and then many times try to fix this on an outpatient setting, but still a bit of urgency to get it taken care of, or possibly getting the patient immediately to the hospital from the office and saying, we need to fix this today. The patients that present to the emergency room that really need immediate treatment, both those sets of patients, we're trying to avoid the ultimate worst outcome, and that's an amputation. And many times we can save limbs while we're also saving the patient's life. They go hand in hand because many times the patients that have potential threatened limbs also have threatened lives from other issues. So while we're saving the limbs, we also uncover some other things that possibly can save their life as well. So in summary, when we're talking about limb salvage, once again, we're talking about two forms of looking at limb salvage. And that is it something that's urgent, meaning we meet the patient in the emergency room and it needs immediate treatment, usually within a couple of hours to restore flow and avoid an amputation, in which case, again, that's something we're moving pretty rapidly to try to figure that out as quickly as we can. Or is it something that's presenting in a little bit more of a slower or insidious way, in such that it's a wound that's present, or it's a non-healing wound, or the patient maybe is having some changes in early rest pain at night, and we know that the circulation is so challenged by discoloration in the limbs or whatever extremity we're looking at, that it's going to become a problem if we don't restore blood flow, which then brings us to the imaging, and then we can determine how urgent that needs to be handled. Is it that day? Can we get to it within a week or two while we're figuring other things out? And ultimately, most importantly, avoiding any possible amputation. Again, it's Dr. Michael Lepore talking to you about limb salvage and the importance of limb salvage, especially as it pertains to vascular disease and vascular surgeons. If there's any further questions, please feel free to comment or contact us.